Hey guys, Bryce from HFHill again. Another one of our educational videos. Dr. Chris Proulx is here with me. We're going to go over the Chattanooga Mobile2 RPW. That stands for Radio Pressure Wave Device. Dr. Proulx?
Sure. Thanks, Bryce. So radio pressure wave is it's an acoustic wave. So what happens is there's a compressor inside this machine, pushes air through this hose, and hits a projectile that hits the end of this transmitter. So the transmitter actually generates the acoustic wave as it hits the patient. Now, a lot of people say, well, is an ultrasound acoustic? And in fact, it is. The pressure exerted from this far exceeds that and is between 500 and 1,000 times the pressure that you would find from an ultrasound, therapeutic ultrasound. And of course, therapeutic ultrasound, you don't feel the mechanical, you may feel an increase in thermal energy. So why radio pressure? Well, what it does is it transmits this acoustical energy into mechanical energy, which thereby can become chemical energy once it reaches down at the cellular level. So as we know from the use of other physical agents, the design of a physical agent in our physical world is to enhance or create a healing environment, to create that optimal healing environment. So with that respect, it is not destructive. So even though a lot of people say, I'm breaking down scar tissue or I'm breaking down a calcification, that's actually not the case. This creates a tissue matrix disruption, right? So it imparts its energy into the tissue and basically sort of slaps it in the face. And as a result of that mechanical insult, it stimulates the tissue to do a few things. And we have what's referred to as both upregulation as well as downregulation. Upregulation means it's going to initiate something, and downregulation means it's going to suppress something. So cell death, for example, apoptosis would be a downregulation factor, or stopping the release of a chemical. Upregulation, it may stimulate reactive oxygen species or increase blood flow to an area and things like that. So the benefit of this is it performs that biostimulatory, or we should say biomodulatory effect that can be both stimulatory or excitatory and inhibitory through the use of a mechanical energy. So mechanical energy can be a very powerful tool influencing the tissue to respond because it's instantaneous. It can stimulate superficial free nerve endings, but also deep free nerve endings. So unlike some of the techniques I do for soft tissue mobilization, maybe with some of my tools or even my hand, this has a depth of penetration, a therapeutic influence between 3 and 6 centimeters. So it really gets to a good depth of penetration that I really have not been able to accomplish with any other type of device. So that kind of brings us to, well, if it's uncomfortable, where would it tend to shine the most? We'll see in the future with regards to maybe some more acute protocols. But right now, it really shines in these apathies, right? Chronic types of conditions that are not during the acute stage, but during a stage where we still have a dysfunctional tissue that doesn't really belong there. And so what this does is it reestablishes the biological sense that bad tissue doesn't belong there, and we need to instigate the laying down of new tissue through that upregulation and the downregulation to help resorb. So it is not destroying that tissue, it is actually creating a disruption, an insult to stimulate all of those biological factors, which will include the resorption of something like scar tissue or a calcification. So we're looking at Bryce's shoulder here, and we're going to say that maybe he has a shoulder impingement, a chronic condition, possibly associated with some scar tissue formation in the long head of the biceps that runs through the bicipital groove of the humerus. I'm not going to get to that with my thumb or even any tools without having to really kind of dig in there. So this, with its repetitive nature, actually creates that transition of acoustical energy into the mechanical energy. Because it's acoustic, we want to use a medium, and we are going to use ultrasound gel. Same process, it's also acoustic. The other thing we're going to think about is which applicator. So there are various applicators, and really it depends on what it is that you want to accomplish. If you're close to a bone structure, do you need deeper penetration? Do you need more focus? Or do you need more dispersion? The parameters that you're going to set is the pressure, which is measured in bar, the frequency, so the hertz, and then the number of shocks, or the number of impulses. So the number of impulses, it has a counter, and typically the range will be between 1 and 4,000 impulses, depending on what it is that you're actually trying to accomplish. In general, we do have some guidelines for this, but in general, what we're looking for from a patient response is we're sort of looking for, okay, that level of discomfort that someone can sustain for a period of time. Okay, so even if you had to pull off, okay, all it does is it just means it's not going to translate the energy into the tissue. Okay, it's not a moving technique. It's not moving like with ultrasound. So really, what we want to do is make sure that you're perpendicular to the tissue. I don't have to press in there because the pressure exertion, I just want to be in full contact because the transfer of energy is going to be acoustic. So pressing in there with a very, very firm hold doesn't necessarily make it much more different. We do want it to be in good contact, and so that's where the transmission of energy is going to occur. So I asked the patient, how does that feel?
Pretty good.
Pretty good?
I can feel it kind of vibrating through the shoulder into my shoulder blade on the backside.
There you go.
Oh, wow.
So now we're up to 1.5 bar. So with this particular device, very efficient with regards to the air that it makes. The compressor does a great job, and the seal keeps that air within the system, making it more efficient, allowing for greater energy to be transmitted to this tip right here. So we're just over 300. We're going to look for a total amount of impulses at this given time, especially when I'm treating a patient for the first time, around 500 at each point. So we can say that we hit 500 there. Now we can move to a different position if I actually wanted to work the muscle in a different area. But remember that the pathology is in a very specific area, and that should be the goal. This is designed to create tissue insult to the area, and it is not a massager. So it generates a lot of energy over a very, very short period of contact time. So I go to my second point, and again, I'm going to impart somewhere between 500 and 1,000 impulses.
Now, Chris, would I feel it not just in the spot where the applicator is, but in all kind of around it?
So,
is that normal?
Depending on what is in the area, if there's any bone in the area, then some of that wave pattern will hit bone, and that will create some referral with regards to where you're feeling this. But it's a fair amount of energy,
right.
And so there's I don't know if you want to call it an echo pattern. So that echo pattern, it actually is acoustic, and because this is referred to as radio pressure wave versus focus shock wave, the radio pressure wave is actually going to create a diverging pattern, which is the opposite of focus shock wave, which creates a converging pattern. So there is more of a tendency to feel it. Now let's say I've reached my 1,000, okay, and I can reset the counter to start over in case I lose count.
Well, it felt great.
Yep,
yeah,
and
really good.
So we're looking for a level of discomfort that the patient can sustain over a period of time. Typically what you'll find if you've done this right is there's going to be some redness. It's a misnomer that we're creating a new injury. We're not creating a new injury, we're actually just trying to insult the tissue to instigate a new healing process, which is different than an injury. We don't want to cause inflammation. That's actually a side effect. So it's normal that there's a certain amount of petechiae or redness in the area, but it shouldn't create a whole lot of achiness or swelling. That usually means we probably went too hard, too far. So I could actually use this if part of his impingement problem is the long head of the biceps. From a motor point standpoint, I would probably want to treat his whole area, and I could actually work the bicep muscle Okay? And so you can work it very similar to as if you were doing some of your other soft tissue mobilization techniques. I mean, the biggest difference is it has a much greater depth of penetration to it. So it's a little bit easier on people as far as their technique goes. And you can use it again with, while performing range of motion and things like that. But where it really shines is getting into those areas, or as I like to say it gets to the itch that we just really can't scratch.